Once again, good morning, good afternoon, and good evening. Welcome to the 959th day of continuous and uninterrupted Zoom session of Ifph. Today we have with us Dr.Rema Devi Ambadi as the guest. He is the Chief Consultant, Dr. Ambadi Homeopathy Clinic, North Paravur, Kochi, Kerala, India. State level faculty, teaching faculty of Institution of Homeopathy, Kerala. Winner of Swami Adridas Award 2020. Former President, Sindhuram, Women Wing of IHK, more than 45 years of experience, and the subject is an award with Dr. Rema Devi Ambadi, question and answer session. On behalf of IFPH, I welcome Dr. Rema Devi Ambadi, please. Dr. Rema Devi Ambadi, are you there?
Yes. Can you hear me? Can you hear?
Yes, madam. Please proceed. Yes, of course. No problem. You are always audible. Yes.
As usual.
This is the topic is an hour with Ambadi doctor question and answer session. So it is up to those who are watching the program. It is your turn to have some questions, to make some clarification on one of the most experienced and intelligent participants of this IFPH platform. Madam, please.
Today I will take one special session. Okay.
Yeah.
You can hear now, Manoj?
Yes, no problem. If any problem, then I shall don't forget. Please proceed.
Okay. It's a common fact that the scope of homeopathy in different field of complaints is immense. According to our interest and capacity, we should select the subjects. That is the only thing we have to do. Fed up with the troubles and financial loss, people turns to homeopathy in every field. Infertility, autism, rheumatoid arthritis, in any field. They are fed up with lifetime diseases, everything. They are coming to homeopathy as a last hope. Since they are fed up with the other treatment, they are ready to wait for us. But our duty is to give result in the shortest, most reliable, and most harmless way on easily comprehensive principles, as Dr. Hahnemann told. I selected this field, infertility, because the risk factor is very less in infertility. Usually in infertile cases, 40% defect will be of male, 40% will be female, and 10% will be both of them, and 10% is unknown. So we should not be biased, and we should investigate both the couples for when we are treating the disease. As in any clinical cases, proper case taking has to be done. We should get all the details regarding their occupation, food habits, addictions, drug intake, family past history of STD or any other diseases, family history, sexual habits, personal and emotional problems. Besides the exact nature of the sexual problem should be, besides all this, we have to know the actual natural sexual problem should be inquired. Can I share the screen? Manoj?
Oh, no, madam. Dr. Baburaj, could you please make Dr. Rema Devi Ambadi co-host? Just not provided, unfortunately.
Okay, all right.
Please wait. Please wait, madam. Please wait. Now it's okay, Hariram sir. Please adjust your camera. Yes, good. We can
Today I
see.
will take infertility, especially female infertility. Today I'll take. Okay.
I think, ma'am, it is better to have some questions from our participants. So it's a question because if anybody is there, then you can wait. Otherwise, you can proceed.
Okay.
There's a
Okay,
question from me.
If you want anything to be asked, if I know, I will tell. I think
Yes,
my
yes,
my
yes.
friend Dr. Santa is there in the platform.
Maybe there. Don't worry.
Please unmute her. Please unmute her. Because yesterday night only, Danesh told. I also was coming after this one holiday. I came yesterday evening. Then night only he told me to take the class.
Apriyam Satyana Bruyat. Don't forget that. Yes, yes. So let us go to the topic. So why, Dr. Rema Devi Ambadi, you did selected this infertility as your main specialty? What is the reason?
What's the reason? the less risk factor is there in infertility, because all the people are coming after taking all the other type of treatment, and they'll be fed up with their troubles, their pain, everything. For they will be having severe pain, fed up with that, and they will be having financial loss. They come to us as a last hope.
Yes,
According to me, I got my first child after 5 years of my married life. On 6th year only, I got my first child. That's why I am most interested in this infertility.
Yes. Then could you please tell what are the medicines you usually found effective in these aspects regarding this infertility?
For
A general survey.
See, usually the infertility is a vast subject. We have to combatize it. Yes. Vaginal complaint, and what is that?
Some rarely used medicines.
Vaginal, cervical, uterine, tubal, ovarian, peritoneal causes is showing the vitality of semen, like that. You must combatize this disease. Then we can very well go to the indicated medicine. If they are having any vaginal problem, we can give for vaginitis or vaginismus. We can give medicine indicated for that.
Yes, so we shall come to later. That's a question. AMH high and low. What is your experience? The first question from Dr. Harinaran Prasad.
Who had asked?
Dr. Harinaran Prasad. AMH high and low. What is your experience?
See, in all the infertile cases, when we are doing the test, we have to compulsorily we do AMH, anti-Mullerian hormone. See, the normal is 1.5 to 4 ng per ml.
Any medicines or therapeutic indications is the question.
So, X-ray 200, Naxumosicata 200 in alternate weeks. This is Dr. Ramakrishnan's tip. He used to tell when the AMH is low, we can give X-ray 200 and Naxumosicata 200 on alternate days, alternate weeks, 1 dose each. Then second, on the other days, cactus tincture 5 drops in the morning around 7 a.m. in warm water, and 10 drops of ashwagandha tincture at 9 a.m. 2 p.m. and 7 p.m. daily, except when giving the X-ray and Naxumosicata, we should give all these medicines. The AMH level should be checked in once in 3 months only.
So I think they are more expecting from
we should avoid the medicine, and all this medicine should not be taken during the period. After the bleeding is
Yes.
stopped, we should again start the medicine.
Yes.
Should I tell
That's
once
an
more?
important. That's it. Yes. Yes.
Should I
That's an
tell once
important
more?
suggestion given by. Pardon?
Should I tell once more about this?
No, you have. Yes, it is clear. It is clear. X-ray. Then Exmos.
And
Some
next
medicines.
on
Okay.
alternate weeks.
Yes.
On other days, cactus tincture, 5
Yes.
drops in the morning, around 7 a.m. in water,
Cactus.
and 10 drops of ashwagandha tincture at 9 a.m. 2 p.m. and 7 p.m. daily,
Yes.
except when giving X-ray and mosquito. Okay.
Okay.
What is the suggestion?
Then, this is the suggestion by Hahnemann. He advises not to give anisoric deep-acting anisoric medicines for 96 hours once the bleeding commences. Meanwhile, you can give Nexomic or Belladonna. It's a suggestion by our master. Then another question is prolactin high. What to do?
Hyperprolactinemia.
Yeah.
I forgot. Just a minute.
Oh, don't worry.
Just a minute. I will tell. I had noted.
Yes. Yes, because you are a specialist. Definitely, you will not all these things.
I forgot.
At this platinum jubilee year.
The first medicine I used to give is Hemophilia. Hemophilia tincture, cyclamen, Maxol, phosphorus. The common medicine I use during this prolactinemia: Pulsatilla, Thlaspi bursa, tuberculinum, higher dose, Attica urine tincture, and Phytolica tincture to 10.
Yes, I think a lot of medicines have described. Then an important suggestion from Dr. T.P. Kumar is prolactin onnam.
Prolactin onnam, that's also nice.
Yes.
I forgot. Oh, sorry.
Yes, Dr. Anil Kumar is a person who is always thinking of homeopathy, nothing but. In 24 hours and 365 days, he's always thinking of new medicines. What is new medicine? What is the action of this medicine or that medicine? He's a really professional. Then another question: at 2 p.m. which medicine?
Cactus only.
Which one?
Cactus only.
Yeah, cactus. Yes. Then another question is
7 a.m. and 9 a.m. and again 2 p.m. and 7 p.m.
Yes. Okay. Then myoma, what to do?
Myoma is a very difficult thing for me. Chandra, have you got any experience treating myoma?
See whether doctor is joined or not. Not joined.
Not joined.
No. Definitely, we have our Hariharan sir is there. He can.
Anybody please help me?
Yes. Bachao. Dr. Hariharan sir, please unmute.
Usually for leiomyoma, I used to give aurum iodum, aurum unatrum, and all these things. Calcarea carb, calcarea flow. Leiomyoma. So for leiomyoma, I used to give all these. So calcarea force or calcarea group, calcarea iodide.
Dr. Manoj, please excuse me. That my line of treatment is not like this.
Yes, I very well know that, sir.
My line of treatment is something different, but her experience is very valuable, very valuable.
Yes.
But in myoma also I will treat it, but entirely different from this way. So I can't say. See, this is the medicine, this is the medicine, I can't say.
If constitution medicine is available, if we are getting the typical constitution medicine, we should give it first. Then we have to see. We have to wait and see. All the other supporting medicines are conium, graphitis, fraxinus, all these things we can give. Nitric acid, even nitric
Yes.
acid and lactic sulfus is very effective.
Lapis lazuli is
Yes.
very, very,
If it is a phosphorus constitution, we can give phosphorus. If it is a creosote constitution, we can give creosote. The
lapis,
difference between phosphorus and creosote is phosphorus is very lean and thin. Creosote is little bit more fat than creosote.
Yes.
That's the only
Okay.
difference.
Yes, yes, you can see a description by Carol Dunham, where an ovarian this cyst or something is cured with colocin based upon the character symptoms. So depending on the character symptoms, you can. So then another question is thickened endometrium. Any suggestion? It's another question.
Thickened endometrium. For thickened endometrium, we can give the medicines indicated for constipation. What the medicines we are giving for constipation, we can give all this medicine for thickened endometrium. Thickness, no, it is dryness. Aluvina and all we can.
see, thiosaminum can be tried.
Thiosaminum, yeah, thiosaminum also very nice. And thiosaminum, but one thing, thiosaminum, you should, all this ovary, thiosaminum, testis, lecithin, all these medicines, you should give powder only, not tablet. 3x powder, it's very effective. But if you are giving tablet, it will not affect so much.
There's Dr. TP once again. Malcolm sale for
Malcolm sale, yeah, that is honey, honey and salt. If that medicine is not available, ask them to take 1 glass of honey water in the cold water. Honey in 1 tablespoon of honey in cold water with 2 pinches of salt. Let them ask to take. Anil, thank you.
Yes. Well, often from the homeopathy perspective, we can expect a few symptoms when you use honey, because when it is taken from some flowers, that will contain its own character. You can see an example, I think, in the arnica. This arnica, when you give, the arnica will produce symptoms of candidiasis, because the Spanish fly often lays its egg on this arnica, this flower. So it will produce symptoms of candidiasis. So similar situations can be there. That is also very interesting. Then
one thing I like to say, see, you said about candidiasis. I like to say one thing. See, one medicine is there, that is candidatin. Candidatin. One of the best medicine for prostate enlargement, along with prostate enlargement, urinary infection and nephritis of diabetic patients.
That is the alkaloid of candidiasis. From the APs also, we are having some medicine. Some I think epion or like that.
That this is
from the sting of that how we know honeybee, from the sting they get the poison and triturate it and give.
This candidatin is also taking from a fly. It's I think it's from the fat of that fly. This is prepared, but one it is not available even in St. George, but one pharmacy has it. I am not remembering that name, but it is a wonderful remedy that I know.
Yes. Then another thing is that regarding the candidiasis, I think Hahnemann suggested this for this rabies, because he said it is not hydrophobia, but it is aerophobia. So you can use candidiasis in case of rabies. Now the modern medicine recognizes more than hydrophobia, it is aerophobia. Then another question, female testosterone high. What is the suggestion?
Pardon?
Female testosterone high.
Just a minute.
Yes. Only a few
Female-
persons are participating this session for asking questions or making some giving some additions. Yes.
Very good.
What are the medicines for this? Yeah.
Um,
Female
uh,
testosterone.
Testosterone. Female testosterone, we should give testosterone itself 3x,
Yes.
TDS. Then we can give the constitutional medicine. In that, when this hormone level is increased, definitely we should take the constitution. Along with that, this is supporting medicine only. It will support.
Definitely.
We can give
Definitely.
testosterone itself
Yes.
3x.
We
First
all,
TDS,
yes, sir.
first for 1 or 2 weeks TDS, then PD, then HSO.
Okay. Then another is, what is your experience in infertility cases? Sendismal or LM potency more active? Which one is more effective in this treating infertility cases? LM potency or sendismal potency?
LM potency, platina, sepia, natramore, ignatia, stalsagria.
No, madam. The question is, which
No.
potency is more effective? That's the question.
Which potency?
Is more effective, whether it's LM potency or the sendismal potency?
No. See, if we are giving stalsagria in 200 potency for a male patient, he will have erectile dysfunction, ED, he will have. But if you are giving the stalsagria to the same person in LM potency, it will not have this bad effect.
Yes.
According
Okay.
to the symptoms, according to their sensitivity, I used to take LM potency or sendismal potency.
Okay. Yes. Then another question is, medicine for PCOD.
PCOD. For PCOD, we have got so many medicines: calcarea carb, carcinosin, lycopodium, medorinum, natramore, sepia, ambragesia. Everything we can give. Abrama, apis, aurum iodum, aurum mette, aurum neonatrum, crocus, colosinde, conium, hamamelis. Everything we can give.
Yes. I think
Don't forget Ufornum. Don't forget
Ufornum also we can give. Phagopyrum, Viburnum opulus is very good medicine. Then senecio we can give in tincture form. Xanthophyllum we can give.
if the
for
patient
PCOD.
is having chest infection along with PCOD, give Amna Vishaka.
Yeah.
Yes.
Ammi Visnaga.
Okay.
Ammi Visnaga.
Ammi Visnaga.
Our doctor from Patmanabhan, his favorite medicine, this Ammi Visnaga. He used to give for elderly infertile people. Ammi Visnaga, ladies.
Okay.
If
Then another question. Yes, sir.
if hyperandrogen is there, you can give ovary 3x daily along with the pulsatilla tincture and give sulfur 1 to 10.
Yeah, sure.
Give good result.
Hyperandrogenesis.
Yes. This time I hope Hariharan sir change his strategy. Now, torch
For
positive.
hirsutism, we can give thyroidinum 3x, and we can give what is that? I forgot that. I forgot. That external we can give. If you are applying that external, the hair will be removed.
Olean check or
Not olean jug, not olean jug. കുതിരയുടെ കുളമ്പിൽ നിന്നെടുക്കുന്ന something related to hose.
Yes.
Castrate tincture, if you are getting, we can apply it with apply it on that face. It will remove the hair as well as there will not be any this black mark.
Okay.
But it's very difficult to get. Since 3-4 months, I am searching for that. I am not getting.
Okay.
That is tincture.
Nice, huh? Presoben.
Yeah.
Can that is tincture
So,
also
yes.
for
That is
external
tincture.
application? Presoben.
For external application, dilute with the water.
Water. Okay. How many times? How many times?
Daily.
Daily.
Daily one
Okay.
time.
Daily once. Only once.
Okay.
That
Now,
is
Rajan,
tincture.
Dr. Rajan, sir, please unmute.
I told Kasaviki no question. I want to say
Okay.
Kasaviki
Yes.
no question.
Kasariki.
Yes, that's good. Then
Yeah,
another
that
question
tincture
is,
we are not getting. Tincture we are not getting. I am searching for it for since last 4 or 5 months.
Sir,
No.
don't forget. Give Sepias tennum 1 potency. Tennum. Because see, erotism is the due to the increase of these male hormones.
Male hormone. Yeah.
That is what is the reason for the Victor class is saying. Not I am saying. Victor class is saying that like so. Sepia is one of the best remedy for that. I have a lot of result in that.
okay, then another question is torch positive case of infertility. Torch positive.
Torch positive. For
Yes.
IgG, toxoplasma we can give. Then echinacea we can give. Echinacea, toxoplasma. Whatever be the this one, we can give that in diluted form. Tuberculinum
Okay.
or
Then,
E. coli. or
another
like
question
that.
is, yes, rubella IgG positive.
Rubella itself we can give. Rubella 200 or 1 now.
Okay. Yes. Then another question is hypothyroid case with very high cholesterol level, suffering from constipation and increased body weight, with dry skin too, age 55. Any advice to treat this? Hypothyroid case with very high cholesterol. Yes.
Ask
Yes,
them
ma'am.
to reduce the fat, especially non-veg things. Ask them to reduce. Then thyroidum 3x we can give hypo as well as hyper thyroidism.
These
Calcarea carb, all this constitutional medicine also we can give.
don't forget
Yes,
graphitis.
Graphitis. Yeah, Calcarea carb, graphitis.
Constipation, then high weight,
obesity.
obesity. These are all
And skin disease is especially if they are having skin disease, definitely we can give graphitis. Yeah, correct.
Okay.
Thank
Then
you.
Another question. Amenorrhea since the time of puberty, unless medicine taken, she doesn't get periods. Amenorrhea since the time of puberty.
Whether she is having any PCOS, just confirm it first.
Yes.
She'll be having PCOS sometimes. If it is so, we have to give medicine like that for that.
Yes. Okay. That is
And
advice to Dr.
hormonal test also we have to do.
Yeah. Another question is ovary 3x pulsatile tincture. Then which medicine?
Ovary 3x and pulsatile tincture for
then which medicine? You have mentioned some medicines earlier. Ovary 3x
for what?
pulsatile.
For what?
That is not mentioned. Dr. Manjula, what is your doubt? Please, you can ask directly to Dr. Rema Devi Ambadi. Okay. Another question is FSH high.
We can give FSH itself, FSH 200 we can give. But FSH should be given in the first 2 or 3, second or third day. You should not give it in the after the third day. Follicular stimulating hormone will be should be increased only second or third day. And we can give if FSH is FSH as well as LH is reduced, we can give FSH 200 on 2nd and 3rd and LH on 12th and 13th of menses. I have got one lady. She is working as a nurse in Dubai, and 7 years since she is married, and they have tried 3 times IVF and several times IUI. And I gave them medicine. Both of them, my protocol is I will give medicine for both of them. Then I gave medicines. Then now she sent me a message that she is pregnant. Third medicine, third course not started. I told her not to start the medicine.
Yes. Dr. Vasanthi suggested sulfur for that condition. FSH
Pardon?
side of sulfur.
Sulfur.
Yes.
Sulfur.
Yes. Then
Keep the conscious.
yes.
For amenorrhea and young age.
Yes.
For
Another
the
question is castor tincture. How to apply? Another question.
castor AQ 1:, I have read 1:5 in oil or water.
Okay. Then for underdeveloped testis.
We can give
For
Beretta
underdeveloped testis.
carb, testis, the pituitrinum, thyroidinum, all these hormones.
Oramet.
We can testis 3F, we can give Oramet, we can give
Hypotency. Oramet hypotency you can give. In undescended testis as well as undeveloped testis, you can give Oramet high 10 on dose.
I think once somebody mentioned Sabal later. I think.
We can give.
Yes. Another one is Nabothian cyst.
Nabothian cyst.
What to do?
That's a very
Rare
vaginal
conditions.
cyst, no?
Yes.
I don't have any experience for that.
We can adopt the Bonian's principle of grand generalization here, I think.
Very
No
correct.
particular
Very correct.
disease are
Very, very correct.
Yeah.
There is boning as that repertory. There is granular remedy. There is, I think there is 3 medicines. I think it's so. See, one is lapis salt, and other is about 3 medicines.
Sisters we can give, I think.
Okay. Then another question is sciatica. What to do? Sciatica.
Or Malaise arnica, everything like that we can give, you know.
See, sciatica according to symptoms. According to symptoms you can give.
Side symptom, the modality, all these things should be noted.
See, colocin and calmia, one of the main remedy. If the pain starts from hip to toe, that is calmia. And pressure amelioration, if amelioration is there, you can do Magfos and colocin. Likewise, we can prescribe sciatica is not a difficult case, not a difficult.
If it is the pain is starting from foot to hip, we can suggest ledum also.
Yes. Yes, our Anilkumar doctor with Nephalium type.
Nephalium, very good medicine. If numbness is also there, if the pain is alternated with numbness, we can very well give Nephalium tincture to higher potencies.
Now, Geeta madam, please mute madam.
Good evening, madam.
Good evening. Good evening, Geeta.
Good evening. For undescended testis, we can try thyroidinum, very effective.
Thyroidinum, we can, sure.
Then for Nabothian cyst, rhododendron and silicea.
Very good. Hypothesis.
Rhododendron.
Yes. So, well, these all suggestions will definitely satisfy
Silicea, which potency,
those
Gita?
asked questions.
Silicea, which
Silicea,
potency?
10.
10. Rhododendron?
Rhododendron 200 in
200.
repeated doses.
Okay. Okay. Repeated, alle?
Repeated.
That for
Another
undescended testis, thyroidinum 10 also 2 doses, no?
2 doses.
Undescended testis.
Undescended.
That is
testis.
Dr. Pragashan, late Pragashan doctor's tip that I forgot. He had given,
Yes,
and
okay.
I had seen the result also.
It's very effective.
Very
I got
effective.
result.
Very effective. I have seen 2-3 times.
Yes.
Thank you, ma'am.
Then another question is menorrhagia.
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 For menorrhagia, we can do all the medicines for this bleeding, no? Homomelis, trillium, viburnum, all these things we can give.
Epihistinum is a suggestion by Jyotirashmi.
Epiphagy, eh? Pardon?
Epihistinum.
For menorrhagia,
Epistedinum, 3x. Yeah.
doctor, don't forget, see, thalapsy tincture.
Thalaspi, I told you,
Thalaspi.
Thalaspi tincture.
For
Trillium,
menorrhagia.
senecio we can give. Homomelis we can give. Homomelis, it is better to give higher potency.
Yes. There is another question, underdeveloped breast.
For that, we can give Beretta carb, Sabal ceruleta, iodum. See, in this one, I think Nash has told or somebody else. See, for thyroidinum, if we want to reduce it, you give thyroidinum 10 cm, 6 doses, 1 day after the full moon. For brain, so breast development, we should give this Beretta carb, I think, or Beretta carb, I think, 1 day after the new moon. Just like a moon is increasing, the breast will be increased, it seems. And just like moon is declining, the thyroid, this one also will be decreased. We can very will give Sabal ceruleta, and senecio also you can give as a tonic. Alfalfa tincture also we can give.
There is another suggestion, Salis nigra from Dr. Surya.
Salis nigra is very good. Very good.
Yes.
Salis nigra, I
Then
forgot.
another question is, what to do for dandruff?
Dandruff. Jaborandi, dandruff. First, you should know the reason why this dandruff has come. Then natramur we can give, Jaborandi we can give, arnica we can give. Then one of my friend, Dr. Shalini Satyaseelan, she used to tell arnica external, not internal, external with Jaborandi is very effective for dandruff. That is her pet. That is her tip.
Another one is cochlearia.
Cochlearia is nice.
For dandruff, yes.
Yeah, cochlearia is nice.
Yes.
I forgot.
I think Dr. Ankumar is with 1 year listening patient, other year listening IFPH, he replies Badiaga.
Badiaga. Yeah, Badiaga is nice.
Yes.
That's good. I forgot.
Yes.
I forget all this medicine.
One of the tip, one of the tip I will give. One of the tip I can say. Simply give calendula oil to apply.
Calendula oil.
You will get result within 1 week.
Very good.
Yes.
First time I
That
am
is the
seeing.
secret of Hariharan sir. Yes.
Yes.
Now Geeta madam, please.
Madam, if it is scaly, not powdery, the dandruff is scaly means we can try sanicula.
Sanicula. And
Sanicula.
meserium. Sanicula.
Sanicula.
Yes, okay. Now Dr. Sajindran is an artist as well.
Sir,
Dr.
in the
Sajindran,
case
please.
in the case of dandruff, Canthari
Yes.
soil externally is having relief, sir.
No, that is what Hari told.
No,
External.
no. I said calendula.
Oh, sorry, calendula. So, oh, okay, this is
In-
Canthari oil, yeah?
Canthari
Oh, sorry,
soil.
sorry. Sorry, Tom.
And I will give along with graphite CM1 dose.
Yes. Well, Dr. Sajindran, please.
I used to
Did
give basilinum 10 1 dose for dandruff treatment. First, I'll give basilinum. Then
Yes.
give
Well, 1 minute. Dr. Sajindran, did you act in film, Dr. Sajindran?
Yes, sir.
Yes.
I
So
have
please
acted in
open your
more than
camera.
5
We
films,
can
sir.
see our film star, please.
Once again,
Please open your camera if you can, so
Yeah,
that we can see
we want to see.
the film star in homeopathy. Yes.
now it is visible, I think.
Yes. Oh, no
Not
problem.
visible.
So, yes, we want to promote everybody from in every field, not only homeopathy, but in almost all fields. Encourage everyone. Yes.
I am not able to open that. Something is something technical problem is there. The video is not getting opened.
Okay, I shall explain. Yes, you can start now. Yes. We want to see the film star.
Yes. Just like our Biju.
Yes.
Biju, no?
Yes. Yes, Dr.
It's not
Sajindran,
getting
Narif,
open, sir.
there are some problems, maybe, yes. In the coming days, definitely more cameras will open to you. That is my belief. I hope so. Now,
Thank you, sir. Thank you, sir.
yes, definitely. Then I took seborrheic dermatitis of scalp. Is another question. Seborrheic dermatitis.
Seborrheic dermatitis. I don't know, Hari. Please help. Anuj.
Vingam and Harihar sir, please.
See, a Vinga minor is good. Vinga minor. And intracranial remedy is basilinum.
Okay, right. Then another question is young man age 20, severe hair loss due to hormonal imbalance.
First, give
Strong
him
body odor.
Oromet. Oromet first. Then
With
see
strong
the,
body odor. Yes.
pardon?
With strong body odor.
Oh, then we can give calcarea cup or Metsol and all we can give, no? For this
Then-
offensive perspiration.
Yes. Another one is psoriasis of scalp. Is another question.
Sorry?
Psoriasis of scalp. Psoriasis of scalp.
Psoriasis of sorinum. Sorinum we have to build. Then mesurium we can try.
For psoriasis, there is no one-shot remedy.
Yeah.
There is a suggestion: sanicula, sorinum, acetnitricum, creosotum.
According
Suggestions
to the
are for
symptoms we can hear. For psoriasis, we have to take the case in detail. Then only we
Okay.
can treat it.
What?
Then another question is premature graying with which medicine?
Premature gray.
Premature graying, which medicine?
Lycopodium.
Then we can
Lycopodium
apply
we can give, no?
Dr. Rema Devi Ambadi, Dr. Harihar, we can apply that medicine for premature graying. I hope so.
we will not apply it then.
It is mature gain.
Yeah.
Still young.
We get
That's
no,
why I
we
asked.
get seat. Seeing this white hair, no, we will get seat. Anywhere, everywhere we give, they will give seat. So I want to make it dark.
Dr. Anil Kumar suggested lycopodium.
Lycopodium I am suggesting.
Yes. His wife also suggested lycopodium. So fortunately they agreed this time, lycopodium for Dr. Anil Kumar as well as Dr. Jyotirashmi suggested lycopodium for two.
Lycopodium is
I told
Yes.
international remedy.
Premature gray lycopodium used to give.
Then
And
another suggestion was
Napramore
yes,
acid force. Napramore and acid force. Premature
acid
grey.
force. Yeah, acid force also we can give.
Bisbadenum. Bisbadenum.
Ah.
Bisbadenum. Jama.
Dr. Rema Devi Ambadi, at last Dr. Sandha Chandra is here.
Chanda, where
Yes.
you had gone? I told you no to be present in when I am making you had to answer.
Yeah. Miss
I told
Madam.
you no. Where you had gone?
They are very good friends. Wherever
Miss Madam.
Dr. Shantachandran goes, they were Dr. Ambadi is there.
Yes. That's good. Yes, Dr. Sajendra, please.
Yes, sir. One more tip
Sajendra,
for
yes.
premature graying is that it was from Cert Sir Treasure. I think Jamil Cert Sir have given the same. They use in 1 month they repeat a syphilinum, along with the
Syphilinum, we can, yeah. Prematurely, we can use
Along
syphilinum.
with which medicine?
Syphilinum.
syphilinum 1 or higher.
Okay. Yes. Acidity for body odor, then thyroid. Another question is fibroadenoma breast. Which all medicines, madam? Fibroadenoma breast. Adenoma breast.
Iodine,
Which all medicines?
calcary iodide, kali iodide, all these things we can give Phytalaka.
Yes. Electric.
Chanda, have you got any other medicine? Chanda? Fibroadenoma?
Fibroadenoma, Sabina.
Kali iodide, calcary iodide, we can all iodides we can give.
Sabina,
All this. Sabina? Scutularia.
Sabina, Kali iodide, scrofularia.
Scutularia we can give.
Not
Scrofularia we can give.
scrofularia.
Scrofularia we can give.
Scrofularia
Scrofularia we can give. That is Dr. Jayaram's, sorry, Jayakumar's tip. Scrofularia. I got it from him.
Yes. Another question is tartar on teeth.
Tartar
on teeth.
Fragaria tincture external.
Prageria.
Prageria.
Tincture.
Yes.
Then calcarea groups we can give.
Dr. Rajan, which I think some rare medicine this time. Dr. Rajan, please unmute.
Pardon?
Dr. Rajan, you can unmute now. Dr. Rajan, please unmute now.
Tell Rajan.
Maybe the network is not allowing him to unmute. That's the problem. Okay. Uterine polyp, scrofularia, then okay. If any doubts, you can ask. 10 minutes more remaining. Anyway, wonderful session. A lot of medicines, hundreds of medicines we discussed.
For
It
tartar on
indicates the strength of
calcarea renalis is effective.
Calcarea renalis. Very good, very good.
And tuja is also effective. And tuja.
Calcarea renalis I had given.
Madam, which one? Calcarea?
Renalis.
Renalis.
Renalis. Okay. Oh, okay.
Calcarea renalis.
For
Very good medicine
kidney stone also we used to give calcarea renalis tedious along with the Berberis vulgaris.
Yes.
In order to
Another
reduce the
question is-
thickness, in order to reduce the thickness of uterus, you can give hydrocortisone tincture.
Sure.
Okay. Another suggestion from Dr. Anil Kumar, any polyp tuja. Then another one is sweating palms with exam paper. What to do? It's a question. Sweating of palms.
Natramore, Silesia, all these things have given me result.
Okay. Yes. Another one is right inguinal hernia. Right inguinal hernia.
We can try lycopodium.
Hypotensive.
Hypotensive.
Suggestion, sir.
In hypotensive lycopodium we can give, and if there is a left-sided, you can give Naxomica. That is these two are internationally known for this right side and left side. Naxomica is left side and right side lycopodium.
Then another question is polycystic kidney. And Dr. Jyotilashmi answered this in Silesia. Polycystic kidney.
Polycystic kidney. We can give Calcarea renalis, then Berberis
I
vulgaris,
think tuberculum is also available.
tuberculum,
Tuberculum maybe.
tuberculum. See,
Now,
today
Dr.
I
Sajendran.
read one medicine, Robinia pseudocacia, herpes on vagina and vulva. Herpes. See, I had a patient, but I didn't go and get this medicine. Then I gave him herpes itself, herpes 200 itself I gave, and he got relief. She got relief, but this medicine I have seen particularly for this herpes on vagina and vulva, Robinia pseudocacia.
Spelling, please.
ROBENIA. PSEUDACACIA. Herpes on vagina and vulva. I had
Dr.
one patient. I
Dr.
gave them herpes itself.
Madam,
Herpes virus.
Please, please.
I have
Dr. Sajendran, please. Dr. Sajendran, please ask.
Sir, my question is whether Jaborandi is not indicated for the perspiration of the palms.
Yeah, sure. For
Phytocarbon.
perspiration, we can suggest, we can give.
Jaborandi, which potency or tincture?
No, I'm not indicating that. I am asking whether there is experience on Jaborandi.
We can give, but I have not. With Natramur and Cyanesia, I get result. See, we are prejudiced, you know. If we are giving, if we are getting result from one medicine, we will always stick on that. We will not see for another medicine, and that is the problem. Big problem.
Doctor, basic cause for the sweating of the palm is anxiety neurosis.
Anxiety.
So, if you are finding out a remedy, we must see also inquire about the mental condition of that patient. Usually, the teenagers have such symptoms. Teenagers.
Yeah.
Now, another session is Plumbamet and Lycopodium from Dr. Ankumar in this case of this sweating. Then hypothyroidism with delayed menses. Which medicine? Hypothyroidism with delayed menses.
With the delayed menses. We can try Lycopodium tenum 2 doses. If it is not acting within 10 days, try carcinosin tenum 2 doses.
Okay.
Definitely we will get result.
Yes.
I
Anyways,
had tried and I got result.
It's wonderful session, and it indicates the strength of homeopathy, and also we must all read a lot of therapeutics books are there. Hundreds of books are there. Especially from Minton's Therapeutics, uterine therapy is a wonderful book. You will get almost all medicines there. Then Dr. Nash.
Manoj,
Yes.
I got Nash.
Yes,
Manoj,
madam,
I want to tell one request to all of the participants. See, our 1000th day is coming. We are going to celebrate it.
Yes.
Try to participate, all this one, doctors as well as lovers of homeopathy. Please try to participate sincerely.
Yes, definitely. That is the most important thing. Without this platform, we couldn't have such interactions.
So many tips we got. See,
yes,
for each seminars, to attend one seminar, we have to spend minimum 500 rupees, isn't it? We are getting thousand seminars.
Effort to travel, much time, a lot of problems
everything
are there.
In
Then
our
again,
office room we are getting.
Yes. Then again, when you go to attend there, some technical problems that will lose a lot of time. But here we start at exactly at 8 o'clock and we'll finish at 9 o'clock. No, let us that. That's the important thing. Moreover, we must support all these things. That's a mission and duty to us.
Yeah, sure.
Because we must remember that the person who took initiative this platform is not a physician. By Salahuddin sir, he's an engineer.
Lover of homeopathy.
Yes, he's a passionate person who offered his Honda Jazz car, rupees 10 lakhs worth in Honda Jazz car, those who prove that COVID cannot be cured with homeopathy. That was the suggestion. if any person who prove homeopathy cannot cure this COVID, he will give his Honda just car to that person. But nobody accepted the challenge. That much dedication he is giving. At that time, what we are giving, as said by Dr. H.R. Roberts, the young man, you should think what you offered to homeopathy.
Yeah.
Homeopathy you offered to you a lot.
But several things you, yeah.
Yes, that's the first chapter in H.R. Roberts. You must think at this juncture of this 959 days, that's 41 days to go to historical landmark of this 1000-day celebrations of IFPH. Because we are a small community, a lot of limitations are there, but with dedications, we did complete it. That is the most important thing. We can say a lot of excuses can be said. I have this problem, that engagement, this engagement, but all these things, everybody has got all these things. But as our Prime Minister said, सब कुछ छोड़ा किसके लिए? For this राष्ट्र के लिए, just like this IFPH के लिए, ये सब कुछ छोड़ा. All these things, just like मेरा परिवार, no. Yes, we have no communications, no telephoning, no conversations, no house visits. Nobody comes to a house, nobody visits our house at that time. Because for the last 3 years, I am sitting here. For what? For homeopathy. So just like that, everybody can do it. There is not about that. Not only when you conducting this program, you have a person to moderate, but that is not enough. There should be a person to always sitting standby. If some contingency or urgency is there, you have to compensate that. Otherwise, this program will not continue. That is why I am sitting even after 9 o'clock. You might have listened that. Because it's quite natural, because we are all human beings. Some technical problems, network problems are there. We must support everybody, each and everybody. So it's after all, it's a teamwork in day 959. I think it's time to wind up the session. May I invite?
Thank you, Hari, Jyoti, Anil, everybody for supporting me.
Yes.
I would have
Dr.
made it.
Jyothalakshmi. Dr. Jyothalakshmi, are you there? Dr.
Yes,
Jyothalakshmi.
Doctor, I am here.
Yes. Yes, please express a lot of thanks to Dr.Rema Devi Ambadi.
Good evening, doctors. Today's was a very, very informative session because all of us were interacting with each other rather than Rema Chechi talking to us. She is a motherly person who is very, very affectionate. I don't have words to explain. Whenever we ask any doubt, she'll explain everything to us. I have never seen such people. Very, very few people are there in this homeopathic fraternity, I feel so. With a motherly affection, she explains everything. She and her friend also, Shanda Chechi also, they both are like twins only. Last week they visited our house, so I was very happy to see them. And today I feel very proud to deliver the vote of thanks on behalf of IFPH and on my behalf. Anyway, it's a very, very, very interesting and very informative platform which we have, God has given us as a COVID gift to homeopaths. Otherwise, we would not have improved this much in our practice. I'm sure it is because of the contribution of all of these learned doctors in this platform. Okay, thank you, doctor. Good night.
Thank you, Molu. Dr. Geeta.
That was the end of
Thank
today's
you a lot
session.
for
you, ma'am.
supporting me.
Thank you.
Same time tomorrow. Till then, goodbye. And it's all Dr. A.R. Ashok Kumar to continue the program in Malayalam. Thank you.
Thank you, Dr. G.S. Manoj.